So again, I'm Lisa Hansel. I'm a psychologist in the Women's Mood Disorder Center, and I'm going to be talking to you tonight about mood and the menstrual cycle. So this is part one of this three-part mini course. And again, it's a group of us who are both researchers and clinicians in the Women's Mood Disorder Center. And our main goal here is to help increase awareness about women's mental health across the lifespan. So around the menstrual cycle, perinatally, and around menopause. So tonight for part one, I'm going to be focusing on mood and the menstrual cycle. So I'll talk about premenstrual symptoms. I'll talk about how we evaluate and diagnose mood symptoms around the menstrual cycle. I'll talk about some treatment options, and then we'll get a little bit into the biology. So I like to start things off with interesting facts. And so this fact is the average woman has 450 periods in her lifetime. So if you're someone who experiences premenstrual symptoms, that's a lot of occasions in which you might experience these symptoms, 450 periods. And so before we jump too much into the details, I'm going to take us back to sixth grade health class for a minute and just do a quick review of the menstrual cycle so we're all on the same page. The menstrual cycle is roughly 28 days. And so the cycle refers to this entire length from the time that bleeding starts up until the day before the next period starts. So we have this full cycle that's 28 days. Within that, we have the menstrual period, which is the time when the person is bleeding. And then we have this premenstrual phase over here, which is the week or so before the next period starts. And we go back to the beginning. And you can roughly break the menstrual cycle into two halves. So you have the follicular phase, and then you have the luteal phase. And they're divided in half by ovulation, which is when the egg is released. So some of the basic terminology out of the way. So I want to start off with this idea that premenstrual symptoms are common. So premenstrual symptoms affect up to 75% of women with regular menstrual cycles. And this was shown in a large study of over 40,000 women in the Netherlands, and it's been found in other similar studies as well. So that means if you have a room full of 10 women, at least 7 of them will have experienced some type of premenstrual symptom at some point. I also want to make a note that I'm using the term women. This is because most of the research that I'll present tonight has been done on women. So just a note on terminology there. So premenstrual symptoms are common. They can be physical or mood-based. And so in terms of the physical symptoms, we can see things like headaches, fatigue, difficulty sleeping, trouble concentrating. We can see things like acne or oily skin. You can see breast tenderness or swelling. You can have GI issues like constipation or diarrhea. You can also have things like food cravings for things like salty or sweet stuff. Sometimes there's abdominal bloating. You can also have menstrual cramps. Some women have a change in libido. And so those are some of the main physical symptoms that we tend to see. We also see mood symptoms. And so these are things like mood swings, low mood, increased anxiety, or what we call affective lability, which can look like crying really easily. And so when we think about these symptoms, what are the most common ones? And it turns out that abdominal pain or cramps are usually the most common, followed by mood symptoms. So again, this is that study that I mentioned before in the Netherlands that was over 40,000 women, and they asked them about their premenstrual symptoms. And so abdominal cramps were the most common one by over 80% of women. And then mood symptoms were the second most common. So over 70% of women were reporting having mood symptoms premenstrually. And this number is pretty consistent across other studies as well. So premenstrual mood symptoms occur on a spectrum. And so, there are often people who experience, some irritability before their period or a little bit of anxiety. And, that's pretty typical. Again, over 70% of women will say, yeah, I have a little irritability before my period. But there's a subset of women who have clinically significant mood symptoms premenstrually. And so these are things like premenstrual syndrome or PMS or premenstrual dysphoric disorder or PMDD. And so I'm going to dive a little bit into each one of these. So PMS occurs in around 20% of women, so 2 out of 10 women. PMS is not considered a mood disorder. This is because PMS can actually include only physical symptoms. So this could be someone who has really significant cramping, really bad headaches, that kind of thing. The American College of Obstetrics and Gynecology defines PMS as having at least one symptom. And this, again, can be any one of those symptoms that I mentioned earlier. It's present in the 5 days before menses starts, and then it remits, goes away within 4 days of the menstrual period starting. It has to cause some kind of interference. So maybe it makes it harder to get things done at work or at school. And it has to happen for at least 3 menstrual cycles in a row. So that's PMS. The more severe end of the spectrum is PMDD. And so PMDD only occurs in around 3 to 8% of women. So, relatively small percentage. It's considered a mood disorder. And that's because it has to include for diagnosis and mood symptoms. In some women, it's only mood symptoms. They don't even have any of the physical symptoms, but it can include physical symptoms as well. PMDD can be quite impairing. And so if you think, the average woman has 450 periods over the course of her life, if you add all of those times up and, she's having symptoms for 5 to 7 days before her period, that adds up to a lot of time. So that can be up to 4 to 8 years cumulatively if you kind of compress everything over the lifespan. And that's similar to the impairment that would be experienced by people who have major depression or dysthymic disorder, for instance. So the prevalence of PMDD is similar to other mental health diagnoses like post-traumatic stress disorder, PTSD, or panic disorder. You can see here in this chart, PMDD is kind of sandwiched there right between PTSD and panic disorder, which are both disorders that we hear about fairly commonly. And I want to emphasize too that PMDD is a severe mood disorder. So this really affects women's functioning. It's not just major depression kind of tied to the menstrual cycle. It's unique from that. And it's often characterized by irritability, anger, anxiety. These are some quotes that I pulled from a paper that came out recently that focused on women's qualitative experience of having PMDD. And the women say things like, I feel like it's an alter ego. I'm a completely different person in that premenstrual phase. I feel very low, hopeless, tearful, but also getting angry, feeling depressed, feeling anxious. And so these are some of the experiences that women report when they have PMDD. So I'm going to talk a little bit about how we evaluate premenstrual mood issues. And so this slide is pretty busy, but I'm going to kind of jump into the details and then zoom back out a little bit. So I wanted to start with PMDD since that's at the most severe end of the spectrum and it's the most complicated to diagnose. So for PMDD, again, you need to have those core mood symptoms. And so you need to have at least one of these 4 mood symptoms. These are affective lability, which sort of refers to mood swings. So being more tearful than usual, being more sensitive to rejection. So if someone says something to you, you might feel more kind of hurt by it than normal. Irritability, this can look like anger or interpersonal conflict. Low mood, so that can look like hopelessness, feeling just kind of down. A lot of women will report really self-deprecating thoughts. And then anxiety, so feeling tense, feeling on edge, worrying a lot. So you have to have at least one of those. And then you have to have at least one of these additional symptoms. So these are decreased interest, so feeling less interested in things that you normally care about, trouble concentrating, low energy, changes in appetite, or food cravings. And so again, women with PMDD often crave things like sugary or salty snacks. Sleep disturbance, this can be either sleeping too much or not getting enough sleep, insomnia, feeling overwhelmed or out of control, and then also physical symptoms. So this is where we see those things like headaches, breast tenderness, that kind of thing. So out of all of these symptoms, you have to have at least 5 total. They have to occur in that premenstrual week, but then disappear once menses starts. And they have to have happened in the majority of cycles in the past year. With PMDD, again, it's a rather involved diagnosis to make. And so in addition to the normal clinical interview that you would do with your healthcare provider, you also will need to do daily symptom ratings for at least 2 menstrual cycles. And so this is called prospective daily rating, meaning instead of thinking back and thinking, oh yeah, I think I might have had irritability before my period, it can be hard to kind of think back and necessarily remember. And so providers, for the gold standard of diagnosis, they ask people to start tracking. And then, we can really get a sense in real time what the symptoms are looking like in terms of the menstrual cycle. And so PMDD diagnosis can be challenging. A lot of patients come in and say that they've had trouble getting an accurate diagnosis. And again, here are some quotes from that paper that I referred to earlier. So women with PMDD are saying, I felt like the healthcare providers thought that I was making this up. My mental health care team was saying, we don't believe in this kind of thing, or I've never heard of it. Or another says that her primary care provider is just saying, oh, you're just depressed. It's just depression. And so in terms of PMDD diagnosis, one of the challenges is kind of finding the right provider to get the accurate diagnosis. And so there was a study done in 2018 by the International Association of Premenstrual Mood Disorders, IAPMD. It was a global survey, and they asked over 2,500 women or patients who were seeking care for PMDD what their experiences were in trying to get a diagnosis. And we found that, patients sought care from a number of different types of providers. So this ranged from primary care doctors to gynecologists to psychiatrists to psychologists. This paper just came out, and we definitely found differences in terms of how the different providers were able to address premenstrual symptoms. And so kind of different strengths and different weaknesses of different types of providers. Another challenge for diagnosing premenstrual mood symptoms is that the symptoms can fit some different patterns. And so here you can see patient A. This is someone who has what we would think of as pretty classic, PMS or PMDD, where they're having symptoms in the few days before menses, and then the symptoms go away. But you can also have people like patient B who have a little spike in symptoms around ovulation, and then they continue to have some symptoms kind of throughout the luteal phase. Patients C and D are also having a pretty extended length of time of their symptoms. Another challenge that women can face when they're experiencing premenstrual mood symptoms is that it gets mistaken for other cyclic disorders. So these can be things like bipolar disorder or cyclothymic disorder, which are cyclic mood disorders. And so often, women will come in and they'll say, yeah, I was misdiagnosed with bipolar disorder. And so basically what happened was the provider noticed that there was a cyclicity to the moods, that the moods were getting worse and then getting better and then getting worse. But they didn't take that extra step and tie it to the menstrual cycle. You also want to make sure that it's not premenstrual exacerbation of an existing mood disorder. So major depression, for instance. it turns out that around 60% of women who have major depression will experience premenstrual worsening of their depressive symptoms. So this is another important thing to watch out for. All right, let's go ahead and move into treatments. So I broke this down kind of by level. So we'll talk about, what if I'm having mild premenstrual symptoms, and we'll talk about if you're having more significant PMS symptoms or if you're having that most severe PMDD. So what if I'm having just mild premenstrual symptoms? So this is, not super exciting advice, but this is what the research says. So it's really important to do some good self-care and really checking in about just some of those really basic things. So getting enough sleep, making sure that you have good sleep hygiene, making sure your diet is, pretty balanced and nutritious. You're getting lots of fruits and veggies, things like that. Physical activity. So this can be something pretty basic like walking, yoga, something to get you moving. Managing stress, which sometimes is easier said than done, but really taking a look at how you experience and manage stress in your life. And also, using things like social support to help buffer some of that stress. So reaching out to friends and, kind of being involved with friends or family members for support. Okay, what if I'm experiencing PMS? So I'm having maybe some kind of significant irritability or anxiety before my menstrual cycle. First step is you want to make sure that all of your self-care is in place. Another thing that there's been a decent amount of research on is calcium carbonate, which is also known as Tums. There have been several studies that show that women with sort of mild PMS symptoms, if they take 500 to 1,000 milligrams of Tums every day during that luteal phase, that can help alleviate some of the symptoms. Cognitive behavioral therapy, or CBT, is another good option. But it's important to talk with your healthcare provider. So the treatment really depends on, whether you're having physical symptoms, mood symptoms, and what those particular symptoms are. Being a psychologist, I have to give a little plug for CBT. And so CBT is a type of psychotherapy where you're meeting with a psychologist and talking about ways to kind of notice negative thought patterns, be able to modify some of those negative thought patterns, and work on coping strategies. So, how do I cope with stress, that kind of thing. All right. And then what if I'm at the most severe end of the spectrum and I'm having PMDD? So there are a number of treatment options for PMDD. And I'm going to run through three of the most common, which are CBT, which we already talked about, selective serotonin reuptake inhibitors, and oral contraceptives. There are other options like GnRH medications and oophorectomy, but those are not as commonly used. So we're going to focus on the more common treatments tonight. So SSRI, selective serotonin reuptake inhibitors, you might have heard of these before. They are the sort of first-line treatment for things like depression and anxiety. And so they're also used to treat PMDD. They actually have a pretty rapid effect in PMDD. So with major depression, it can take several weeks for the SSRI to kick in. In PMDD, you often see an improvement in symptoms within 24 to 48 hours. They can also be given at a relatively low dosage compared to the doses that are used for major depression. And for PMDD, you can take them continuously as you would for major depression, which is when you take them every day. But they can also be taken intermittently, which means they're just taken during the luteal phase or the premenstrual phase. Oral contraceptives are another treatment option for PMDD. There's really mixed evidence for the efficacy of oral contraceptives for PMDD. And I think in part this is because there's such a wide variety of oral contraceptives, each with a different formulation of hormones. So the one oral contraceptive that is FDA approved to treat PMDD specifically is called Yaz. It's a monophasic contraceptive, which means that it's a constant hormone level. So you're not having any fluctuations in the level of hormone. You take the same level every day. And then you take the active pill for 24 days, and then you have 4 sugar pills or inactive pills. And so there have been a number of studies on Yaz that have shown that it helps reduce PMDD symptoms. There was a meta-analysis of this that came out about a decade ago that showed that it had pretty good results. All right, so we're going to go ahead and jump into some of the biology. And so, one of the sort of obvious questions that we get often is, what about hormones, right? Because, with premenstrual symptoms, we see this ebb and flow in the symptoms with the menstrual cycle. And we also see hormones fluctuating across the menstrual cycle. And so you kind of put two and two together and think, okay, well, hormones must be involved somehow with these premenstrual mood symptoms. And so that is true. So hormones can have really powerful effects on the brain and on behavior. And so, the main female hormones, estradiol and progesterone, are produced in the ovaries. But, they can travel through the bloodstream and actually act on the brain as well. And so one of the hormones that we're really interested in terms of PMDD in particular is it's related to progesterone. So progesterone, again, is one of those main female hormones. It gets metabolized or converted into something called allopregnanolone, or allo. And allo is what we call a neuroactive steroid hormone. So neuroactive just means that it affects the brain, it affects the central nervous system. And so allo, it actually acts on the same receptors that things like alcohol or benzodiazepines would work on. And so benzodiazepines are things like Xanax. And so because of that, it has these anti-anxiety and sedative effects. And so we think that what is going on with allo is that it may be interacting with those receptors in a slightly dysfunctional way. And we know that it's not just the level of hormones. So if you measure hormone levels in the blood of a person who has PMDD versus a person that does not have PMDD, their hormone levels look the same. So it's not the hormones themselves. It's what we call the hormone sensitivity hypothesis, which is the idea that this is actually an altered brain sensitivity to normal hormonal fluctuations. And so I bring you back to this image of the menstrual cycle. And you can see over here in the luteal phase, this is this premenstrual week over here. You can see that there's this really rapid rise in progesterone and then a really rapid decrease in progesterone. And so we think that women with PMDD, for instance, their brains are a little bit more sensitive to these major fluctuations than women who don't have PMDD. And so that's an active area of research where we're trying to figure out, what is it about women with PMDD or PMS who are responding to these changes in hormones in a little bit different way than women who don't have these mood symptoms. All right, so that was a really quick whirlwind tour of premenstrual mood symptoms. So in conclusion, I just want to emphasize that many, and in fact, I would say most women experience premenstrual symptoms of some type, whether it's mood or physical. In terms of the mood symptoms, these occur on a spectrum of severity. So it can, again, range from mild irritability for a day or two before your period up to, full-blown PMDD. The good news is there's a range of treatment options available. And there are also a lot of good resources available. So I've included two. One is the International Association for Premenstrual Disorders, IAPMD.org. And then womenshealth.gov is another good place to get basic information. And with that, I would like to thank everyone for attending and listening. I want to also thank my team, so my really fantastic colleagues at the Hopkins Women's Mood Disorder Center, as well as people who participate in research, both in my research and in research in general. So, the data that I showed you tonight from all these different studies, this was made possible by people who decided to volunteer to go be in a research study. And so research is, really important. If you're interested in research, it's a really great way to kind of get involved in supporting women's health. I also want to recognize my funding sources. So I actually didn't talk about any of my funded research tonight, but those are my funding sources in case you're interested. And then my contact information is at the bottom.